Tarsal Tunnel Syndrome. Certainly it's a condition that you should be well aware of. I don't know how many cases you see in a given year of patients who have Tarsal Tunnel Syndrome. It can be disabling, it can be very painful, and we're going to take a look at a few important points that I have learned through the years in an attempt to alleviate the symptoms from this condition. Diagnostic testing, MRI can be helpful. Provocative nerve conduction velocity testing, and I'll tell you what I mean by that. CT ultrasound. If a patient is developing tarsal tunnel syndrome, the sensation of burning or sharp pain radiating into the foot, or noticing contractures of tendon or the toes bending down occasionally through the day, these are patients who may have symptoms secondary to the hyperpronation syndrome. If you're ordering an NCV, it may not come back abnormal. So when I order these, if I suspect it's secondary to pronation, I do a provocative test. That means I want that patient walking down and back a number of times, hyperpronating, irritate the nerve, and then have the test done. So that, to me, is provocative testing. They also do that, by the way, with carpal tunnel. You're going to select a product that's going to be most efficacious for you, whether it's straight amnion or an amnion-chorion sandwich, which has amnion on both sides. It's an easier structure to use. Some are frozen, some are just dry, and you just wrap around it and moisten the environment, and you now have this beautiful envelope, which we rarely even suture over the nerve. It just wraps around like putting saran wrap around a sandwich.